Now we go to the SNRIs. So again, with the addition of the norepinephrine transporter blockade, you would expect these to have efficacy in neuropathic pain, but with an additional contraindication that you would avoid in angle closure glaucoma. Why? Because norepinephrine, when binding to certain receptors like beta receptors in the eyes, can lead to, changes that can be deleterious in glaucoma. So it's like, there's a reason why beta blockers are used in open angle glaucoma, which is different, by the way, from angle closure glaucoma. But you would expect that drugs that increase noradrenergic neurotransmission in the eyes would worsen conditions like angle closure glaucoma. So just kind of, contraindicated there. Yeah. Plus, Venlafaxine, they're generally pricey. Plus, Venlafaxine's half-life is also... Is it visible? It should be. I should move out of the way. There we go. It's also super short. Super short. So, personally, like, Venlafaxine, yeah. An interesting thing about Venlafaxine's mechanism, actually, is at lower doses, Venlafaxine is an SSRI, actually. It has more affinity for the serotonin transporter at lower doses. It's only at the higher doses that it functions as an SNRI. So just something to be mindful of, din, if you want to try a different mechanism when you're switching. The norepinephrine might lead to slight increases in blood pressure. Nothing serious unless you stack that effect with other drugs that can increase blood pressure. So, yeah. Duloxetine, by the way, is also a CYP1A2 substrate. So, be mindful of drugs that can inhibit or induce 1A2. Smoking, for instance, might affect duloxetine concentrations by reducing them, right? Or 1A2 inhibitors might boost its levels. So, basically 1A2, it's a very under-recognized but very important CYP interaction to be mindful of, right? And yeah, the hepatic stuff. Why is there urinary retention? So again, because these block norepinephrine reuptake, so increased norepinephrine, those bind to alpha-1 receptors in the bladder that can affect urination. You go back to the ANS lesson.